recorded at Medicines from the Earth in June of 2014. For more information on our conferences, lecture notes, and recordings, visit our website, botanicalmedicine.org.
Yesterday, I almost finished up, or the slides, that is. Almost finished the slides. I tried to make all three talks sort of tether into each other, so that the whole thing was a bigger story arc, because there are all these situations and diseases, predisposing conditions are all definitely connected. But I kind of ended up, I was talking about vitamin D a little bit. And I was talking about glutamine, and I wanted to just clear up when I was talking about glutamine and talking about the one kind of caution to keep in mind when you're using glutamine is that in patients, it's a specific case where I said be careful. So it's a patient who has active cancer, diagnosed, who know they have active cancer, and they want to support themselves, but they're not doing anything anti-cancer as far as like a chemotherapeutic regimen or radiation, or they haven't done surgery, and so they're dealing with this active disease which is growing. And in that case, you can give small amounts of glutamine, but if you start giving large amounts of glutamine, then that can become a substrate for fuel production for the cancer. And there's a lot of different sides to that equation, but I'll just tell you that it's good to be cautious because we don't know. Nobody's got a microscope and a little camera down there watching what's happening. We're all just thinking about it and looking at the microscope and seeing things frozen and trying to extrapolate how it would look in real time, but we don't really know. So I just say, because there's something called the glutamine transporter, and that's a system that moves glutamine into the cells, and it can be used as fuel by cells, and especially cancer cells. So that's why I just said, just be cautious, because people will often, in radiotherapy and chemotherapy, folks will give 20 grams a day, 30 grams a day of glutamine, and that's a pretty big dose if you have an active disease that's able to just start pulling in that fuel source, because cancer is very adaptable and it'll take advantage of whatever you give it, pretty much. That's why the kind of targeted therapies for cancer, as good as they are, when they target a molecule or they target a receptor, if that receptor is blocked long enough, what generally happens is the cancer changes, it evolves, and it finds a different way to get its fuel. And what I mean by fuel is it takes energy from some kind of a molecule that interacts with the receptor on the cell, which then gives the cell the energy it needs to differentiate and to divide and make two new cells. Oh, okay. Oh, great. Let's do that. No apologies necessary. I'll move this closer. Can't drop it first. How about that? Okay, let's see. So that's closer. Do you have any volume here?
In the back. But
oh, it's only in the back?
I don't know. Yeah, I'm going to help.
Okay. It's the same thing that happened last time I was in this room. That sounded good. It sounded like volume. So I can also speak up, too. Just talk a little louder. Hello, hello, hello. I could just talk like this. Hi, how's everybody? So anyway, there's that story of how the cells derive their energy. It's called phosphorylation. It's kind of like, you get to burn a stick to start a fire. You've got to start with something. You start with a match, and the match has phosphorus on the front of it. When you scrape that phosphorus with enough friction, it causes an activation energy that allows the chemical reaction to happen, and the match catches fire. That's what's happening at these receptor sites when you have these different growth factors that are hitting the cells, and it's giving the energy to phosphorylate so the cell can then go into division. And so, not that glutamine does that same thing, but glutamine will be a fuel, like sugar will be a fuel for cancer. So just be careful. Glutamine's a great thing. It's not bad. It's just that because I was talking about it and using it in high doses, I think it's important to remember that there are cases where you want to be specific about your dosing and not just choose to go, ultra therapeutic in your dose. Okay, that's good. And then we're clear on the chocolate thing. Are you playing with the sound? It sounds like it. Okay, that's pretty loud. Check. How about right there? If I keep it at that height right there, is that pretty good? Do you have a mixing board back there? Maybe not. Okay. So, anyways, we'll jump into today. So, we've been following this course of adrenal fatigue, kidney essence deficiency, and how essence deficiency leads to an inability of our body to quench the fires that we need to make in order to run our life processes, and then also fires that get out of control due to traumas, due to toxins, due to burdens, due to any kind of overload on the system that causes something to go out of control, a process. So when we start talking about the thyroid, one of the things I've been doing lately with my talks is I created a couple lectures last year that were based on the thyroid and based on what's called the kidney yang energy in Chinese medicine. And I've been talking a lot about kidney essence, which essence is what becomes either yin or yang in the Chinese medicine concept. So it can be a material that's more nourishing, more moistening, more cooling, more soothing. That's the yin side substances. And the other side would be something that's more invigorating, something that's opening, something that's elevating, it's lifting. That's the yang side. So it's just one way to identify the duality of difference in compounds that can come out of that kidney essence system. So in the thyroid, there's a lot of dependency on the kidney yang, which is this warming force. And one of the Chinese ideas they use is that in your body, if you thought of the energetic cycle kind of as a hydrologic cycle, you'd find that it would look like a fire underneath a pot or a kettle, and then that kettle would be bubbling and it would steam upward, and all that steam would rise up, and that's sort of like the chi coming up through the body, and then that would collect atop the lungs like it would be clouds collecting on the top of the mountains, and the water would come down through the waterways, and it would be like rivers, and it would fill all the water, like we talked about the spleen being like a pond and the stomach being like a lake. It would filter the water down, but it's that kidney yang energy that gets everything up, steamed and moving, and invigorates activity in the body. It gets the physiology going. So I was talking about a concept I had, which was a 3-furnace system, and that was the base furnace of your body. You still hear me? Which was the kidney yang, and then there was the furnace of the thyroid, and the reason it's a furnace for several reasons. One, it directs the metabolic rate of the human body. That's what the thyroid does. It tells every cell in your body how much sugar it's going to take in or how much fat it's going to cut up to make ATP, so you can run cellular processes. Okay? I'll get more in detail about what that is. Also, the thyroid is a very kind of hot place in the sense that what's happening there with iodine and thyroid hormones is a very kind of fiery reaction. It makes lots of really excited radicals. It's very hot. And so it's my number 2 furnace. My number 3 furnace is the little furnace inside of every cell in your body. And it's really inside of every mitochondria. And it's really thousands of trillions of some incredible number of little furnaces that are burning in our bodies that are producing energy. It's just like we have a furnace in our house to keep things going, keeps the pots boiling, you can cook with it, it keeps you warm. That's what's happening in our bodies. So if we go from the cells, those trillions of little stars, and we come in, where are they getting their force from? They're getting their force from the thyroid, but the thyroid is getting its force from the kidneys. Its original fire. And then the Chinese have this concept of the Ming Men, which is the life gate, which is at about the 4th vertebrae. The L2 vertebrae, 4th up from in the lumbar. And that's where this sort of conversion of essence into chi, or life force energy, is happening to come up into the body. So I start with that place, that kidney energy, and then the adrenals being more contemporary, but we've kind of relating these concepts, right? I'm relating this kind of Taoist concept to a modern day perspective of, dissecting the body and then reducing it to its parts, so we can get those two things going together. Kidneys, adrenals, upward energy, heat directed to physiological function, the thyroid gland, and then out to all the cells to see what's happening at every little layer, even in your fingertips. Okay? So today's talk is going to focus on that second furnace. And I put this picture of iodine up here because iodine is one of those limelight supplements, and it's kind of always in the medical literature, and it's kind of coming up as, a very, we talked about vaccines yesterday, as something that's controversial, something that's like, which way do I go? Can I touch iodine? Oh my God. And we're going to talk about that issue. And it's essential for the thyroid function. We can't make thyroid hormone without it. So our thyroid gland, shaped like a shield, kind of the shield right in the center of our throat here. It's very much an organ of expression. Your outward energy, it's that fifth chakra. People talk about the voice and expression and all that. It definitely has that kind of craze. It has that link to our being, our physiological expression of ourselves. How energetic are we? How outgoing are we? And so that's where the thyroid starts to play a big role in who we are. And like we said before, there's genetic issues that can come up, but most of these things it's very influenced by what we eat, what we think, how we act, what's in our environment. It's one of those glands, because I said it's kind of a fiery place and there's a lot of energy moving through it. It gets affected really easily by things. So it's kind of unstable in that way. It's more excitable than some other places in the body, like the kidneys, for example, more stable. So this slide, I like it because we're talking about those two different the relationship between those two different parts of that furnace system, the kidneys and then the thyroid. We have this stability issue I was talking about, and it's really between the adrenal kidney system and then the rest of the neuroendocrine glands, which I said was the pineal, the hypothalamus, the pituitary, the thyroid, and then the adrenals, which are directing function, directing the music being made by the musicians, your organs that are experiencing your life, that are expressing yourself. They're being connected through those central organizing organs, okay? At the bottom of that are the adrenals. They're down low. They're really stable. Remember I said rhythm, first year and a half of life, stability. And I use the metaphor of being on your bike and having a steady kind of balance, because you've got momentum. You can go through the mud and you won't fall down. Whereas if you don't have momentum, you can fall over and everything kind of collapses. So you want to have momentum. We want to be able to feel like the stability is inherent in how we are, every day. Okay, when that stability isn't there when you were very young and your parents didn't live in the same place, when you weren't able to be taken care of, you're born into this world from the womb, from that kidney salty place, and then from the womb you come into the world, and then you're asked to breathe by yourself, find a way to feed yourself, and be a person in this world. It's really challenging. So that's why it's so important to have that nurturing presence of a mother, father, of people to take care of you. You're suckling on the breast, you're getting fed, everything. You cry, you're being nurtured, that kind of a thing. And then every day you're kind of just being taken care of, whether you're in a little papoose or you're being held in a carrier somewhere, you're comfortable, rather than being put somewhere on the side or being taken out with forceps, being left into an incubator. A lot of things that happen that isolate the child from that experience of nurturing, of that womb-like experience out of the womb. And when that isn't set up for the child in that first year and a half of life, there's this lack of patterning, there's this lack of comfort, there's a lack of stability in the sense of it's going to be okay. And people start to get this sense of oh my God, it's not going to be okay. Something's going to be wrong. I'm not going to get fed. I'm going to be left. I'm going to have an emotion that's not going to be tended to. It's going to be unstable for me. I'm going to move. I'm not going to be comfortable. I'm not going to be able to sleep when I want to. That happens for these people in the first year and a half of life. Can we fix the sound, or is it kind of shot? What do you think? It just keeps kind of coming on and off. I'm not sure if it's possible to make it better. No, we'll just check in it someway. I can't stand it. I'm a musician. It's kind of in and out. And that could be a battery issue because it's kind of coming on and off. So we should check the batteries in this guy. Maybe I'll just talk louder for a minute. So anyway, so when the stability is lost at the foundation, what happens is you start to see at the top. I always think of this long kind of connective piece of some kind of like a pendulum, but a pendulum that goes upward. And at the top of it is the thyroid, and at the bottom of it is the adrenals. So a little shift down here, a little instability makes this thing go, whoa, what's going on up here? So what happens is it's hard to see down into somebody's kidneys. It's hard to see down into what's happening down at that level. And you can run a CBC and a comprehensive metabolic panel on somebody, but if they're not having frank organ disease or organ failure, you don't see too much. There's not a whole lot going on in those tests. If your creatinine's normal, it doesn't tell you that the kidney's functioning at a very high level with regard to all of the cellular processes that it directs. You're not measuring all of those. So what I'm saying is there's ways of finding out how are people doing at that base level. One of the ways we can see it is what happens up at the barometer, the thyroid. And it's a really important concept for me, just thinking about it as a barometer. And it's interesting that the analogy, when the barometer reads that the pressure in the system is off, make sure that the barometer isn't broken. That's a good thing to figure out. And broken could be that your thyroid was damaged by some kind of radioactive expression, a toxin. It could have been damaged by a physical trauma. It could have been damaged by a cancer. But most of the time, the barometer is giving us a reading of what the weather is going to be like, based on the pressure in the system. That's interesting. If we want to change the numbers on barometric pressure meter, we should find a good pressure relief valve if it's too high, or add some moisture and or heat if it's too low. So there's my analogy. So the same kind of thing, and I'm thinking about this on that simple level. Is the person hot? Is the person cold? Do we want to add some heat? Do we want to add some cold? Hey, do you guys want to check the battery in this lav?
It's a new battery.
It's a new battery? Okay. Just that in and out thing is kind of odd. Or maybe it's a signal thing? I don't know. I'll just keep talking so that you guys can figure it out. And we're going to talk about how adding salt can be a way to add stability to the system and could kind of anchor fluids in the tissues and help stabilize that barometer as well. So I just want to give you that idea that it's like you're looking at the thyroid to measure sort of what's happening at the deeper levels, which is where we get into an interesting dilemma about thyroid hormones. Do we give hormones? Do we not give hormones? Do we always give hormones? Do we not always give hormones? Sometimes, maybe. And I want to talk about that a little bit more. Factors that affect thyroid function. I like this because it just kind of gives you a nice little breakdown of different aspects of how the thyroid is affected by different parts of our environment, our physiology, specific nutrients, iodine, tyrosines, zinc, selenium, vitamin E. Some of the B vitamins. I've been talking a lot this weekend about cofactors and how important they are to have the cofactors present, to have those building blocks that you need in order to make changes happen in the body, to facilitate processes to happen. And then factors that increase conversion of T4 to R3 specifically. This is something that I want to talk about a little further. Is there's hormone conversions that are happening that if you don't have those cofactors present, the conversions can't happen. Or in the case of the thyroid, you actually get a conversion that's a reversal of the way things are supposed to go normally. And what happens is you get a stored form of a hormone that's not usable by your body, and it can look like you're really deficient when in reality it's just you're missing something, a cofactor. Improving cellular sensitivity. The cells are very important. The thyroid gland is important. But remember, our thyroid is acting at the cells themselves of the body. The thyroid is being produced in the gland, the T4, but then it's being converted into T3 or reverse T3 out in the body by different enzymes that are out there. And then there's other organs, the kidney and the liver especially, that get very intimately involved in the thyroid hormones being excreted or being maintained in the body or being broken down. Okay? And those things can get involved in what the thyroid picture is. It's not so simple as this little gland that's pulled out of the body instead over here, and we're going to look at it, and here's the thyroid. This is our patient with thyroid problem. We're going to treat her thyroid. She's tired. That's not how I do it. Cortisol is a big influencer in this case too. We talked about cortisol, and then the hormones, estrogen and testosterone, and then things like insulin are very influential on thyroid function as well. Estrogens will have a generally depressive effect on the thyroid over time. At large amounts of estrogen, they'll promote insulin, and insulin will also reduce thyroid function. In the same way, thyroid function, when it gets lowered, you'll have higher levels of insulin, and you'll have less burning of sugar in your cells. So it's a vicious cycle in that way that we can, because people who start to get hypothyroid, they start to feel lethargic, can't lose weight, start to lose their memory. It's kind of that adrenal fatigue stuff sets in on a really deep level. But then more specifically, thyroid pieces of it come out. You start to see thyroid-specific changes. Lateral third of the eyebrow starts falling off. I find that one a lot in people. People see, like, God, what's going on with my eyebrow? And people, a lot of times they paint their eyebrows, especially on that lateral third. That's a classic hypothyroid condition. Cracked heels is another one that's just a big one. I always find that in people. The cracked heels. On that backdrop of the fatigue, the person who's having the memory problems, the person who just feels lethargic and they just can't get themselves out of bed, they're never rested, they don't sleep well, all that, which I was saying the same stuff with the adrenals, right? Very similar picture. It's just that you can start to get more specific with the thyroid gland because there's certain things that are more thyroid directed, like those things I just mentioned. So that's just kind of a little overview of what some of the influences are. And of course you've got toxins up there, pesticides, mercury, you've got fluoride, you've got infection, trauma, radiation, any stressful situations, and of course autoimmune disease, and then the celiac, which, whether or not you're celiac, you could be sensitive to gluten anyway. And sensitivities to gluten are a big player in thyroid disease specifically. So I'm always looking at that. So we're back to autoimmunity. We talked about autoimmunity yesterday at length and about how the autoimmune process happens. We kind of talked about how the body has to quench those little fires, right? That we keep talking about, that idea that when a fire is contained, it works really well. When you have it insulated, you have it contained, you have good fuel coming in, and the way that you get rid of any of the byproducts, you get rid of them efficiently. It's kind of like carburation, get rid of the burned off stuff quickly, you can burn new things. So all that needs to work really effectively. If it's not working effectively, what can happen is you can have problems occur, and one of the big things is you've got to insulate that fire with the quenching network, and when that breaks down, the fire starts to break outward and things start to burn. Your house starts to catch on fire. So it's good to have a good insulated fireplace. So 3 targets for the antibodies. And we're back to the idea of the antibodies, right? So the immune system has identified part of the self as non-self, right? We've built an antibody to a part of one of our tissues. Those are called epitopes. You find that the immune system identifies some piece and says, I think that's not us and we need to get rid of it, so let's build an antibody to it. The antibody comes out of the lymph system, sticks onto that antigen, that antibody generator, and it makes an antibody-antigen complex. That complex then sticks to some tissue somewhere, and then macrophages and natural killer cells, T cells, come along and break it up and pull it apart and try to clean up the mess. But in the process, they're taking out their tools, they're cutting it into pieces, and pieces of your blood vessel are getting broken off in here. You got a little inflammation. It's another little fire. So every time that happens, you're initiating the cycle again. So you've got to put the cycle out again, put the fire out again. But it's every time you trigger it to keep going, it takes more of your energy to stop it from going. Remember, we spend more of our energy stopping ourselves from just going out of control. We have to hold it just to be mellow. That's why meditation is so important, and why I said sleep, when you go to the deep place of sleep, where you're gone from your body and the body's just there and you're connected to source. You don't get that anywhere else. So 2 different types of autoimmune thyroid disease. Graves' disease, it's our hyperthyroid condition, and most hyperthyroid is Graves' disease, specifically being autoimmune thyroiditis, where the thyroid is inflamed and there are lymphocytes making antibodies to your own thyroid tissues. And then Hashimoto's disease is generally hypothyroid. But what happens is in the beginning, when things are getting haywire, when things are going screwy, when the barometer's getting off, the Hashimoto's picture can look a little bit up and down. It can be a little bit deceiving, so don't get fooled by it in the beginning. You got to follow people over time. And when you're looking at lab work, remember, lab work, those are snapshots, moments in time. And I'm always following cancer patients for years and years and years, watching all these numbers in them. And a number on a page isn't very meaningful to me, but a graph with numbers moving over time, then I start to see trends and patterns. And if a number is marching in a direction over time, it's very clarifying to what's happening in your mind. Whereas if it's just, there it is here, I don't know, well, which way is it going, and where did it start? What do we do? Is our stuff being effective? Are we being effective? It's hard to say. So we've got to watch things over time.
What's TPO?
TPO is thyroid peroxidase.
What's TG?
TG is thyroglobulin. And I'm going to hit these more in detail in a couple slides. Thyroglobulin, thyroid peroxidase, and then that's the thyroid stimulating receptor hormone, or thyrotropin receptor. The TRA antibody is thyrotropin antibodies. And that's an antibody that's built towards the thyroid stimulating hormone receptor. So just to kind of clarify the physiology, so the way the thyroid is getting its information, like I said, it's getting a lot of its fire from the kidney. That's all being interconnected and intercalated through these different chemical messaging systems, right? Well, it goes up to the hypothalamus. Hypothalamus is measuring in the body how much thyroid hormone is available, how much circulating T4, circulating T3, and these are two different forms of thyroid hormone. T4 is the main form. It has 4 iodines. That's why it's T4. Okay? Tyrosine is the main amino acid, and then 4 iodine molecules to make thyroxine, to make T4. That's your synthroid when people are giving people hormones, synthetic form of that hormone. And then T3 has 3 iodines. It's tyrosine with 3 iodine molecules. One of them has been stripped off. And T3 is much more highly reactive. It's much more metabolically active than T4, many times. So what's normally happening is that you're making the T4 in the thyroid gland, and then you're converting it to T3 in the peripheral tissues, and it's being taken up by cells, which are then using that energy to activate their production of ATP. Going to burn sugars, going to burn fats, going to make energy. Question? No. Okay. Oh, those guys. Oh. Hey Neil, how's it going? We got our immunologist back there. Does that answer your question? So those are the. I'll hit these a little bit more in detail, but the TPO, the thyroid peroxidase, is essential in making T4. It's essential, but it causes a little fire. It sends a free radical. It's peroxidase, so it's making hydrogen peroxide radicals inside the gland. Okay. Is everything clear? Okay. So I'll just say one thing about it. When you make the thyroid hormone and the hydrogen peroxide radical is being made, what's happening is that your body has to quench that free radical. It's the same thing that's happening in your mitochondria when you're burning sugar in the presence of oxygen. You're also making a free radical. You're making free radicals, and then you have to quench those free radicals with glutathione. That's our main quencher. There's also the thioredoxin system, but these are sulfur-based compounds that quench the reactive site on that reactive peroxide radical. So imagine that peroxide, it's like if you don't have any chemistry, imagine it's sort of like a really shaky substance, and when it gets close to something else, it shakes that something else too. And that other thing starts shaking, and pretty soon they shake so hard they break apart and something, they grab onto some other person, other piece of something, and they become something different. That's what a high energy molecule does. It's so vibrating at such a high frequency, it makes something else break apart, and then it breaks apart and gives itself into 2 new forms. And those 2 new forms could be toxic, they could be highly reactive, or they could be more reduced. It's just depending. That radical is going to do something. It's radical. It's going to get out there and make a change. That's where that word came from. So a peroxide radical is hydrogen and oxygen, 2 hydrogens and 2 oxygens, which leaves those oxygens unpaired. So they're just like, oh my God, I really want more electrons here. I don't feel comfortable. So it's unbalanced. And so that molecule wants to go into the tissue that's surrounding it and grab onto something and make a change. Well, changes can often be tissue apart, a little bit of damage, and that damage has to be repaired, but better to quench that free radical before it has a chance to do any damage. That's where the quenching radicals comes in, and that's where this sulfur-rich compound comes in to quench those radicals, which is where we're going to find that in the thyroid, it's very important that we have that quenching system in place. If that breaks down, then we're going to start to have damage to the tissue, which is going to confuse our immune system and demand that our body get involved in a cleanup crew, kind of in action in the thyroid, which is going to cause this cycle of inflammation, which is going to cause your body to look at yourself over and over again, and that's where the mistake gets made, where you tag some of that inflammatory stuff, you pull out a piece, and then your body builds an antibody to it, and it sticks, and now you're in this process. You have autoimmune disease. It's not permanent, though. It's not like you can never reverse it. It's not like the body can't unlearn what it learns or learn a different way. So I want to hit gluten because it's so important in this case. AITD is autoimmune thyroid disease. Gliadin is the protein structure of gluten. And so I got a few things in my picture, bread, pretzels, pizza, bagels, pasta. These are all things that have a lot of glutens in them. And most of the time people will look for gluten-free substitutes today, and they're becoming more and more available. It's not very hard actually to go non-gluten. It's pretty much accepted among people who work in this field that about 50% of people who have thyroid disease have a gluten sensitivity, where gluten is very involved in the development of their autoimmune thyroid problem. Okay? So that's a high enough percentage that I pretty much just pull every thyroid patient off of gluten for a while at least, until we get the system calmed down. Now what happens with this thing is that you get back to the gut because you're eating gluten, and it's you can also get gluten through the skin. Some people become so sensitive that they can put on like a lotion or a shampoo or something like that has gluten in it, and they can get reactive to it. And that's why I was talking about the other day, when you're trying to rescue somebody from a deep adrenal fatigue or from a severe situation of autoimmunity, it's not an 85% thing. It's not 95%. It's 100%.
Do the other grain lectins also resemble thyroid tissue?
No, I mean they can in some people enough. It's just that gliadin is the closest one that we know of. Just about anything could cause it. You could have a sensitivity to dairy, to casein, or to lactose, and end up with autoimmune thyroiditis. But it's not nearly as directly correlated as the gliadin is. It's just kind of predispositions. You could have your autoimmunity end up in your thyroid even if you weren't sensitive to gluten. But gluten is just so directly, and there's I put just a few studies up there, you can check them out, but there's just a few people who have dug around out there and taken a look and said, gosh, is gluten really directly connected? And then they give you a little physiology about how gluten looks like thyroid and so forth, and then they did tests in animals or in people and showed the relationship. It's really clear. So okay, yeah, sorry, I got it. Thank you for pulling me. If ever questions come up and I get off track, pull me back, please. Yeah, so 100% though. I'm saying 100% on your anti-autoimmune diet, which is basically I pulled out those 13 foods, which I talked about on Friday, which is very important for me. And I'm not going to do the list again because it takes a while. Everybody has to write it down. It's in the book. Perfect. So it's in the book, and make sure you look at those 13 foods because I pull them out during the acute rescue phase. It's not a permanent thing. I'm not telling people that they can't eat those things for the rest of their lives, but we've got to get the system to calm down. Everything is excited. When the fires are burning and things are shaking and vibrating, you've got to calm it all down. So I pull out all the things that are basically acting as fuels to push that system into its hyperstimulation.
Would you do the same if the person comes to you who is on symptoms?
It depends. I mean, generally I do. It depends on what that person wants. If a lot of people come to me saying, I'm really not wanting to be on thyroid hormone the rest of my life, and that's a talk. That's a dialogue, and how we work through that. And there's a process, and I'll get to that as we go into the thyroid treatment part. But the gut is so important because when you disrupt the GI flora, and the flora is just not functioning in a way that's harmonious, what happens? The compounds that are made there change. I talked about the roots as they interface with the soil being our foods, being all the nutrition we put in our sides ourselves, or the toxins, whatever it is. When the life that lives there isn't supporting us, changes occur. And we talk about dysbiosis nowadays, which is basically the influx of molecules that we normally wouldn't take into our bloodstream. They would generally be either broken down further in the duodenum, in the lumen there, or they would be, excreted. But what's happening is there's an extracellular matrix breakdown that happens under the presence of inflammatory processes happening in the bowel that changes the permeability of the gut wall to different compounds. And so gluten is one of those things. It starts to come through as this big compound gluten. It gets right into the capillaries, and it circulates through the body, and it comes up to the thyroid. And it can go to all the tissues in your body. So the blood, the interconnected vascular system goes everywhere. That's why people are always trying to treat the eyes with eye drops. I'm like, the eyes are connected with the rest of the body. There are mechanisms that separate them, that do isolate systems, but they're not isolated. The blood that feeds your eyes is the same blood that feeds your toenails. It's the same blood in your body. So that's why this GI stuff is so important, because the entire vascular network goes through this, what's called the mesentery. The mesenteric arterial and venule system surrounds the mesentery, your intestines, and all the interface between your roots, your lacteals, those long columnar cells with little villi that are interfacing with your food. There's little capillaries running right along this inside of those things, and those things are interfacing with whatever you're pulling in. It's just like this incredible interface. And then that blood goes right up to the liver through the hepatic portal vein and goes into the liver, and then all that blood is metabolized through the liver before it gets put into the heart, into circulation. That's happening with everything you do every part of every day. So it's not like you can't just take part of you and think about it over here. I just keep saying that. It's all woven together. The plumbing is connected. So another big part of the process in thyroid is goitrogens, and this became pretty popular when people were really into soy, because soy is a goitrogen as well. It's not as strong as some others, and I find the strongest one that I have is really cabbage. And it's raw foods of the brassica family in general, and there's a long list of brassica foods. But the ones that are most influential, the cabbage, cassava, the Brussels sprouts and broccoli, those are the ones that are big. And so people were eating a lot of salads. They were doing this, kind of feel-good diet. And, back in the 80s especially, my mom was one of these people too. She would eat her salad with, raw mushrooms, which you can't digest in the first place. You can't break down the cell walls. And then you've got raw broccoli, raw cauliflower, and you're eating these things a lot. And what they are is they're pretty powerful goitrogens. And goitrogens are any substance that affects the thyroid function. It blocks the utilization of iodine in the thyroid, and you can't make thyroid hormone. And so what's interesting is that not everybody gets that problem. Not everybody suddenly has this, response to eating raw broccoli. But let's say that you've been pushing real hard, you've got a family, you're working, you got, your husband has a job, there's a lot of stress in your life, you're drinking sodas and eating candy and just kind of doing your life and watching TV, and the next thing, everything's going and going and going, and you're stressing out, you're worried about your kids, and then you're eating goitrogens all the time. Well, suddenly you start to get the effect from the goitrogens. They start to influence your thyroid gland. And then what happens is the thyroid function starts to get suppressed. And that did happen to a lot of people at that time. So that's just something to watch out for. But I'm going to use the goitrogen idea as one of our prime therapies for Graves' disease. Because what happened back in the 40s was people were using iodine primarily to treat Graves' disease. Huge doses of iodine, because if you overwhelm the system with iodine, it will shut down the production of thyroid hormone as well. So huge doses of iodine was the treatment for Graves' disease, which is that hyperthyroidism, back in the 40s. But then pharmaceutical companies were looking for ways to make money, and you can't patent an element, and iodine's very cheap. So a few drugs were made based on goitrogens, based on the sulfur-containing goitrogenic substances, and they made something called methimazole and propylthiouracil, and those were the two main drugs produced that inhibited thyroid function, could be produced for cheap, and could be patented and sold for a lot of money. And many people have tried to stand in the way of that and tried to pull the tide a different way, but it's a big wheel turning again, a lot of power, a lot of money, and it's hard to change things. Someone had a question over here? What is it? Fermentation is better. Yep. I would definitely go, kraut is better. The whole vinegar part of it counteracts a lot of the goitrogenic activity. I don't even think it would be goitrogenic. It's funny, I've got a friend who has a sauerkraut company, and we're always kind of talking about it. We don't have any real data, but nobody's gotten a goitrogenic effect from kraut. And kraut is often used to stimulate hydrochloric acid production, because vinegar stimulates the parietal cells to make hydrochloric acid. So hydrochloric acid is like this stomach fire, this next level of fire where you're burning up all your food, and it gives you the energy. It's kind of like this counter action towards that goitrogenic effect of like a raw cabbage. So all you got to do is make sure your cabbages, your Brussels sprouts, your broccoli, make sure that stuff is steamed at least a little bit, and then it won't be goitrogenic anymore. It's big. Yep. I've got a whole section on the halogens.
Should it be questions?
Oh, sure, yeah. She was asking about the chlorine connection, and as far as the toxic effect on the thyroid, and definitely. And we're going to talk about that's why I started this. My first slide was iodine, the element iodine, and I want to talk about the column of the periodic table column of elements, which the halogens are all in the same column, meaning they have the same valence, they have the same outer shell of electrons. That's the fluorine, chlorine, bromine, iodine, and the other one, astatine.
Cooking the millet also.
I believe so. Yeah, I often have people use millet as a way to counteract gluten. And, yeah, it's good for the kidney a little bit, and it's a nice nourishing food. It doesn't have any allergenic substances that we know of. Some people say it's related to corn. I'm not sure. Mostly my favorite grains, if I'm having people do grains, are wild rice. As a not even a grain, it's really a grass, and then quinoa is a good one, amaranth, and sometimes rice, depending on their blood sugar issues. Rice is fine; it's just starch, What's that? Buckwheat. Not buckwheat for me. I'm still not convinced that buckwheat doesn't have some influence on this reactivity with the gluten issue, even though people will say it's a non-gluten food because it's buckwheat. I pull people off buckwheat too. Okay, so let's look at just real quickly. We're back to autoimmune diseases, and the gender prevalence in women is much higher than it is in men. And Hashimoto's 50 times more. 50 to 1 women to men that get that disease. So, if it's a man who's feeling kind of this certain lethargy and memory loss, these kinds of things, it's very unlikely that he's going to have Hashimoto's. But if it's a woman, it's quite likely. And for a long time, people weren't even looking at Hashimoto's. They were just looking at people who are hypothyroid. And what happened, and I was talking about Dr. Derry, one of the doctors who treated a lot of thyroid patients in Canada with iodine and with glandular thyroid. He was a big proponent of using glandular thyroid, not synthetic thyroid. He really got his license revoked and got in a lot of trouble, pretty much because he was outspoken against the way people were treating these things. Looking at, just basically using synthetic hormones to treat any kind of thyroid problem or any hypothyroid problem. And his big point was, you can't just look at the lab work, folks. It's not just a bunch of numbers on the page. It's a person. And so the person's going to respond differently based on how you treat them. And for me, if you don't straighten out their adrenals, you're only addressing the barometer. Why fix the barometer if it's not broken? If it's just telling you what the weather is going to be like, prepare for the weather, and get down to, if you want to change the weather, you got to find a way to, do something a lot deeper and a lot more profound. And if it's the weather in the person's body, if their body is the ecosystem, you want to change the weather in their body, well, we've got to start to work with the elements that are present. And that's why I like the principle approach of Chinese medicine, because I can see where there's water, where there's not water, where there's fire. I can see where there's earth, where there's metal, or where there's wood. What are the elements that show up in this person's constitution? How can I treat that? So that's why, again, pulling back from all this biomedical stuff into, again, a principle-based approach that allows me to see the person in their interface with the world. Okay, so thyroid disease in Chinese medicine, for 50 years, and I like that, that's until the past 50 years, that's how the Chinese speak, That just, translation oftentimes is a little bit different. Thyroid disease could not be definitively diagnosed in China. So they didn't really know what they were dealing with. They didn't even really know that the thyroid gland existed. It was a part of other, diagnostic differentiated patterns that they would talk about, like spleen qi deficiency, kidney yang deficiency, that would manifest as these thyroid deficiencies that now we can identify with lab work. But even if we didn't have the lab work, we still treated them, and people still got better, But if you have a lab number and you have a drug, it works. You sell the drug to the people that have the number. And I'm not saying it's wrong. I'm just saying it's the lazy man's way to, fix the problem. It's not. It takes a lot more work to get deep with somebody and understand their physiological system, understand the weather pattern in their body, and then work hard to change it. It takes a lot of time and energy, and it demands a lot of work on the patient's part. You've got to convince your patient that they're going to get well if they do what you tell them to do. And it's hard to do that if you don't have the experience, if you haven't done that a few times, Once you've done it a few times, you can say with confidence, I've watched this happen over and over again. It's going to work for you. And then someone says, really? Wow, okay, I believe you. But when you're like, okay, I learned this thing, and here's what we're going to try, people are like, oh my God, am I really going to commit to doing this? You didn't even know? So, but I can tell you that you can say with confidence that, many people have done great work in the realm of thyroid health. I'm sure, Peter, you've had a lot of thyroid patients. I know we've worked on a few in the past, and people do really well. They really do, especially if they just listen to what you have to say. And the big thing that I want them to hear is, you're the athlete here. I'm the coach. I can't run the race for you. I can't, perform for you, but I can give you some guidelines and make a game plan. And if you follow it, and of course the people do their own research and they learn things and they come back and teach me things, which is great. But it's this team player type of mentality that I need to convince the patient to take on their own role in taking back their health. But it's much easier, again, to just fix the barometer. God, but it's so easy to just take the thyroid hormone and I feel better, or maybe you don't. Some people do, some people don't. But symptoms will change, and if anything, your numbers will change on lab work.
A lot of times people take Synthroid for years, and the temperature never normalized.
Right.
What happens, it never comes up. They're just doing what the doctor told them.
Mm-hmm. Exactly.
Because the TSH may look good on their lab work, but it doesn't.
And that's not to say, though, that a number of people also get great relief from Synthroid. There can be fear, and we get back to how important the fear thing is. When we get back to that kidney system, that's really important. The fear is really important because it's running that stress pattern. Oh my God, is it going to be okay? Is it going to be okay? Is it going to be okay? That's sapping that quenching network. Is draining you every moment, and you don't have what you need to stabilize the system. Instead, you're actually instigating the system to shake out of control even more, feverishly, fervently.
The other thing, the TSH levels on the labs are different for men and women, and the lab people will not get it.
Right, it's just one big number. It's under. Right now, it's supposed to be under 3. Above 0.38.
It's not getting to the cells, and so therefore it may be floating around the blood, and it is absolutely.
You're right. There's way more to that picture than just the TSH, and I don't base any treatment on the TSH. I have 7 basic tests in my thyroid panel. I don't think I put that in here, but it's the TSH, it's the free and total, T3 and T4. It's a test called reverse T3, which we're going to talk about, which is very important. It will. It's about how the doctor codes it, because there are actually defined diseases involving that process. So you've got the TSH, you've got the free and total T3 and T4, you've got the reverse T3, you've got TPO, thyroid peroxidase. That's the enzyme I talked about that converts iodine in the thyroid and makes it available to make the hormones. Then there's a couple other tests. There's antibodies now to thyroid peroxidase, TPO antibodies. That's a great test. That's pretty much the Hashimoto's deciding factor. If you've got elevated TPO plus elevated TPO antibodies are being made to your TPO, you've pretty much got Hashimoto's. And then there's thyroglobulin, and then there's antibodies to thyroglobulin. And now there's also antibodies to the thyroid-stimulating hormones, like TRA. They call it the thyrotropin antibodies, TRAB. And I've got that listed. I showed the test a little bit ago. I do test iodine, but the only real test I use is the 24-hour urinary challenge. It's a 50 milligram dose of iodine, and then 24 hours after you collect the urine, and then you look at the average. You shake it up, take a sample of the urine, send it to the lab, and they see what the measure of iodine is. And I just measure the iodine. I find that the exposure can be worked. If they do have exposures to the chlorine or fluorine, those are not long-lasting elements. They're not going to get tucked away like something like a metal, like a lead or cadmium or something else that might get tucked into the body. You can move through them more. I think it's more quickly in flux, and oftentimes people have an exposure that's kind of constantly coming up for them. If they're very chlorine sensitive, it's in their drinking water, it's in the pool that they swim in, or if they do Watsu, or they're in the pool all the time, they're being exposed to chlorine every day or bromine. Those people need to pull that, they need to get themselves out of that state. And I often I just try to pull people out of the toxic environments. But I haven't had to test them. Probably Walter does.
Is the way you get them out of those environments is to suggest filters on their...
Yeah, just don't use chlorine or bromine, ideally, But yeah, if you're getting city water and it's being chlorinated, then you have to dechlorinate it. You have to get a filter. And my number one filter is a solid carbon filter. I don't do reverse osmosis. I would say that probably, I think so. Yeah, I think that this one we're going to make it.
Have we hold questions until the end?
Yes, are people getting bothered by questions?
Yes.
Okay, let's go. Sorry, later. Okay, thyroid disease and T-cells. So I want to talk about real quick, we differentiate patterns in Chinese medicine. That's what we do. We look at the person. A big one is temperature. Ask everybody, do you feel hot or cold? You go, well, my temperature is like 90 something. I say, no, do you feel hot or cold? Is your sense of your own temperature warm or cold? Well, I don't know. And I'm like, okay, well, if someone else is standing in a room and they've got a sweater on, are you wearing a t-shirt and you're comfortable? And they're like, ooh, it's chilly in here. That's a person who's running hot. So running hot or cold is a big differentiating piece for me. It gets back to those 8 principles. So you got to differentiate the pattern of the person to treat them as a whole person. Okay, most people with hypothyroidism are going to be cold. They're going to be cold. They're going to have low energy. They're going to feel depressed. They're going to not wake up in the morning rested. They're going to have dryness in their skin. Their bowel movements are going to be slow. This is a little bit of brain fog and memory loss. That's the hypothyroid person. The hyperthyroid person is going to be jittery. They're going to have rapid heart rate, tachycardia, like this. They might have tremors. They might have itching. They're irritable. They're just, oh God, they can't stop going to the bathroom. They're having many, many bowel movements. They can't sleep well. They're waking at night to go to the bathroom. That's the hyperthyroid patient. So you've got these very two dichotomous type of pictures. And when you start to see how these things manifest in the clinic, you can really pick them out. You're like, oh wow, that's the hyperthyroid person, because you see these few symptoms that really come out. But in Chinese medicine, we're looking more for, like I said, it would be like a kidney yang deficiency, or in the case of the hyperthyroid, it would be like a kidney yin deficiency, where the yin and the blood, the quenching networks are all broken down, and it seems like the person is just vibrating out of control. They're very hot. They're very excited. That's the Graves' disease person. So, but with our differentiation, we can do a lot. You ask a lot of questions, get a lot of details, and then look at the person within whatever your model of assessment is. Use that and make that your primary treatment background. Goiter and scrofula. Scrofula is really a lymphadenitis. It's like a lymph infection in the throat. Scrofula. It's like swollen, throat glands. And then a goiter is any swelling of the thyroid gland, and that can happen during Hashimoto's or during Graves'. It can happen during hypothyroidism. It can happen, with certain tumors. There can also be masses in the throat that are different types: phlegmy type masses, soft masses. Most endocrinologists want to biopsy anything you've got there. I find that generally, if it's not a hard mass, depending on the person's symptoms, we can treat it internally and topically. And Phytolacca is one of my favorite topicals for that system. I use a Phytolacca extract, an oil, that's poke, and use it with a few other things to kind of start to move energy through the lymph system. That helps to drain really well. Boswellia is a good one, as an essential oil in there. And so goiters are a good indication that the thyroid's not functioning right. Something's going on there. So, pathological factors in TCM, entangled qi. This is liver qi stagnation. This is one of the biggest patterns in modern America. People who are upset, they're frustrated, they're working every day, they've got too much on their plate, and they just can't get through it. And they're just like, and the liver is the big decision maker, right? It's like, it's making the decisions for your life. And the gallbladder is your real, like, every little bit. How do I organize every little piece? So it's like emulsifying fats is what the liver does. It's supposed to take the big stuff. My mom died, or, oh my God, I've got to change jobs. The big fatty stuff that you got to chew on for a while, the liver and the gallbladder emulsify that into little pieces so that you can then take it and absorb it and assimilate it into your body and decide what you're going to keep and what you're going to let go of. That's your life experience relationship to those organs. So it's very important. When the liver gets blocked, you're not moving through stuff very well. There's things that you can't break down, and so it's stuck. And the liver is like, I'm getting filled with these, emotional life event kind of unresolved issues that then manifest physically, physiologically. And then also with compounds in the environment too that you can't metabolize. If you can't break them down, what do? They keep circulating, they get tucked away somewhere. People show up, these lipomas show up. What's a lipoma? Well, it's normally the body's unable to move through some fatty event, a life event, or some exposure to something that's fatty that we need to get rid of in a fatty way, like through the fat metabolism system. And then the body says, well, I can't get rid of that, so we're just going to put it over here. And you stick it, and it gets walled off and becomes a glob of fatty material. That's what like a lipoma is. It's really interesting how those things manifest in people. But you'll find them and go, what is that? And that's one of the ways that I've connected, some physiological aspects to those, the appearance of lipomas. And those are a phlegmy type of mass. So phlegm masses are soft in nature, they're squishy, you can move them around, they're movable. Whereas hard masses, which are more blood stagnation, stagnant blood. Remember, tumors are stagnant blood in Chinese medicine. Blood stagnation is what is the tumor. We call them in modern medicine a coagulopathy, what is the coagulation has gotten so screwed up because the cells that were, neogenic, they're cancer cells, neoplastic, they're actually making their own network of blood vessels, and they're changing the environment so that the blood is really sticky and slow, it doesn't have a lot of oxygen, it's full of sugar. It's what cancer wants. It's twisted the environment, the angiogenic environment. And because of that, it's a coagulated area. So tumors that are hard like that, they're masses, they're hardened outer tissue, those are more tumors. So when you're feeling somebody's thyroid and they have a lot of really hard, fixed masses, it's time to talk to the endocrinologist and figure out what's going on. If it's a soft mass and it's more, you can move it, it's squishy, we can treat that. It doesn't mean that people with hard masses, you can't treat them too, but make sure you rule out serious conditions, because it's a hot, fiery place, and sometimes cancers there can be aggressive. So we have liver and heart, heat and fire. That's basically that type of condition where if the person does have tachycardia, they got that racing heart, they're always in the edge of a panic attack, they're kind of having heart palpitations, we call it Shen disturbance in Chinese medicine too, but the blood pressure might go up, definitely an elevated heart rate, and that's kind of like this is this heat condition. Look for that. Yin deficiency, people are dry skin, dry mouth, they're having dry hair, they're basically having night sweats, hot flashes. Those are all the yin deficiency type of symptoms, and we look for that. That's more of a condition of Graves' disease than it is of the Hashimoto's, but it can be a combination as well. And then qi and blood deficiency, where the qi of the body and the blood of the body is deficient. Those are our main pathological patterns. Principles are to treat those things, clear heat. And we use our plants, and that's why I like Chinese medicine herbalism, because you're not trying to find that this herb has a compound that treats this part of the body or this disease. You're finding an herb that relates to the condition you found in the body. So this is an herb that's bitter and cold and clears heat from the liver and the gallbladder. This person has damp heat in the liver and gallbladder. Okay, well, let's use those materials. But they also have a little bit of spleen deficiency. So we want to support that person by giving them some nourishing herbs for the spleen so that they don't get damaged by the cold, bitter nature of this herb. So we start combining things in harmony in that way to create formulas that balance themselves out and are work for the person. But it's based on principles. It still works. It works great, actually. So these are just some principles for treatment, okay? So let's talk about Graves' disease more specifically. Biomedical treatment is synthetic goitrogens. I mentioned methimazole and tapazole, propylthiouracil. Pretty much people get put on those drugs right away. If you have a TSH, that's basically down to zero. That means you're not releasing any thyroid stimulating hormone from your pituitary gland. Okay? So the way the system works, hypothalamus measures the hormones. What's going on out there? Okay, we need more pituitary, release more thyroid stimulating hormone. So you get the thyroid releasing hormone from the hypothalamus, thyroid stimulating hormone from the pituitary, then the thyroid hormone made from the thyroid. So you've got primary at the thyroid, secondary at the pituitary, tertiary at the hypothalamus. Does that make sense? That's how it works, hypothalamus to pituitary to thyroid. So you can have problems going up the chain, but most of the time in most of these people, it's a problem that's happening at the thyroid in some relationship to what else is going on in the body. But it's like if your TSH is your main indicator of the barometer's function, which is for most doctors, that's what they're looking at, and medical doctors specifically, and a lot of doctors for a long time just looked at TSH. How much thyroid stimulating hormone is present in the blood right now? Which is all that's telling you is how strongly is the pituitary asking the thyroid to do its job. Hey thyroid, we need more. Hey thyroid, we're doing good, don't do any more. That's what the TSH is doing, stimulating the hormone to be produced in the thyroid gland. Okay? The hypothalamus is our measurer, and the pituitary is our conductor, like saying, okay, this is what we need to do, based on what the hypothalamus is telling me. So, the goitrogens, methimazole, it basically just interferes with iodine uptake and utilization in the thyroid, blocks the formation of thyroid hormone, drops the amount of thyroid in the blood. So then the hypothalamus goes, oh wait, there's no thyroid in the blood. Whoa, we need some. And it tells the pituitary, hey pituitary, tell that thyroid to make some thyroid hormone. And then the pituitary says, great, here's some thyroid stimulating hormone. And then it goes into the thyroid goes, oh cool, alright, we'll make some hormone for you. So hormone starts getting made, and the hypothalamus is going out there and says, oh, There's hormone now, there's thyroid hormone now, it's good. Okay, good, that's the right amount. Just that much right there. But what happens in these conditions, in Graves', is that when that autoimmune condition happens, there starts to be a big flare-up of this energy, this heat energy, and I said this antibody attacking its own tissue, creating this incredible reaction. Thyroid peroxidase, the system that makes iodine available for making thyroid hormones, that starts to get really hot and going really fast, and starts making lots of thyroid hormone. Not under the influence of the hypothalamus and the pituitary, but on its own. It's going, we're just going to do this. And then the hypothalamus is like, whoa, there's a lot of thyroid hormone out there. Stop, just don't do anything. Or it doesn't even have a stop back. It just doesn't say anything. It just says, I'm not going to tell you to make any more. And then after a while, you go to the doctor and you get your TSH measured, and it's less than 0.01, which is below. It's not detectable, and it should be between about 0.4 and 3.0. That's about the range right now for the international kind of standard. And in that case, what you have is you have a system that the thyroid gland is just basically going crazy on its own. It's just, like I said, that cycle got out of control, and it's just running itself. And what's happening is all that thyroid hormone is showing up in the bloodstream, and it's pushing all the cells in the body to make energy quickly. So you start burning up all your reserves. People start to get skinny. They start losing weight really quickly. They get dry and skinny and shaky, and their heart rate goes up. Now, this is okay. Like, you can treat these people if their heart rate isn't above 120. If people have a heart rate of 120 and it's stable like that, we need to get them on a protocol quickly that's going to make it influence. If you can't get that heart rate down, they could be at much higher risk for a cardiovascular like a major problem that could happen. They could have, basically blowout in aorta. They could have an aneurysm. They could throw a clot. They could have any kind of problem. They could have a heart attack. And so we've got to get those people under control. Okay. But other than that, if it's not in that kind of dire situation, if they just have they've got diarrhea, they're having this anxiety, they're having heart palpitations, but their heart rate's 100, it's okay. Just let's get them going. Let's start treating them. And even people who have a high heart rate, if we can treat them quickly with very powerful medicines, we can do a good job. So most of the time, the methimazole will work for a while, and then people after a while, either they get off the methimazole. What will happen is the endocrinologist will see the numbers come back to normal again, that TSH rises again, the thyroid hormone levels go down. Okay, thyroid hormone levels go up in Graves, TSH levels go down. Okay, TSH down, thyroid hormones up. Opposite in Hashimoto's. Okay, so once those levels start to normalize again, then what will happen is after like maybe a year and a half, 2 years, the person will be taken off methimazole and see if they stabilize. It doesn't happen that often. Most of the time, people will destabilize again, unless we help them. We can help them stabilize. Even if they're on the methimazole, the propylthiouracil, we can really help them stabilize as they come off of that drug. And some people come to me on the drug saying, I want to get off this drug and I don't want to go to the next step. Because what's the next step? It's radioactive iodine. It's I-131. So basically you're going to put radioactive iodine into the system, and it's going to all go right through the thyroid gland, and that radioactive iodine is going to replace all the iodine in your thyroid, and it's going to do a huge amount of damage until the thyroid gland is so damaged that it doesn't make thyroid hormone anymore. That fixed your problem. That's what they do. And then thyroidectomy. That's another way to go. Just remove your thyroid. Well, the barometer doesn't seem to be working. Let's get it out of there. And then beta blockers are often used because they have a real profound effect on the heart rate. Slow that heart rate down. Beta adrenergic receptors on the heart, these receptors that when they get stimulated, they get the heart going real fast. Block those receptors, and then the body calms out. But I'll tell you, most people feel terrible on beta blockers. They just, you can't, it's like, you get on a little moped and you're like, sweet, I'm going 38 miles an hour. Well, with a beta blocker, you'd only go 28 miles an hour. Even though the thing could go 50, it would go and stop. So it's kind of the feeling that, hey, you want to go do something? Yeah, let's go do something. Let's go. Oh, yeah, I want to go do something. Let's go. Oh, yeah, I'm kind of here. That's not very fun, You just can't. Life isn't so fun anymore. No, heart rate. Heart rate. Heart rate's more important in this case. You will get blood pressure elevations, but not as much.
But to do or not do what?
If the heart rate's over 120, you need to make sure you get interventions in place right away. The person needs help. So botanicals here, Western herbs, botanical, we've got all these different things, cardiac constitutional assessment. I'm just going to kind of move, we talked about all that stuff. This is a great remedy. This tincture for Graves' disease is awesome. It works really wonderfully. You get it on people right away. It's 50 mils of motherwort, 50 mils of bugleweed, 20 mils of lemon balm. It's a classic remedy, and it works wonders. It's very few things I find that are just like, this works for this, but this is part of what I do for people, and this tincture works really well. And I start out with 4 teaspoons a day, taken with 4 doses of cabbage juice. There's our methimazole, but it costs a lot less, and it doesn't have the side effects of aplastic anemia and agranulocytosis that you get from those drugs. Does everybody have that formula? This formula works. People tolerate it really well, and I'm telling you, you get a person that has this elevated heart rate, this Graves' picture, get them on this tincture, they immediately feel better.
How long do you continue it?
I continue it as long as they need it. What I do is because what will happen is, it depends on if you're treating them only by symptoms, you got to get their symptoms normalized, and then what I do is I generally drop the dose slowly over time. Some of my patients right now have dropped to none, and some of them have gone down to half their original dose. I've got one woman who had really severe Graves' disease, and right now she's taking half the dose. She's got 2 teaspoons a day of the tincture with 2 doses of the cabbage juice with it. She started at 4, and she's at 2. And her TSH was at 0.01, less than 0.01. Last test it was at 0.08, and it's been about 5 months. But she doesn't have any itching. She has no tachycardia. She feels great. She's living her life. She's a midwife. She's doing fantastic. I've got 6 Graves patients right now, so it's really interesting. I got to keep moving along this. It's really quick. Okay. So motherwort, Leonoris, also a Chinese medical herb that promotes blood stagnation to dispel stasis of blood. Great for women. Great for men too. Good blood mover though. Soothing for the womb, kind of all that kind of blood stagnation there, but then really specifically used for heart palpitations by the Greeks and Romans, and it works well in that capacity. Bugleweed, Lycopus virginicus, that one is also specific here for the thyroid. It actually will, through several mechanisms, it increases the output of T4, improves cardiac symptoms, and decreases T3 via reducing that peripheral T4 deiodination. Deiodination is the process by which the T4 becomes T3 as it's going to influence the cells. Lemon balm, Melissa, we know that one. It's a very calming plant. You smell it, you feel more calm. It just calms people down. It's really nice. And that's what it does here. It actually has this increased, helps you get rid of T4. That's part of its calming effect. It kind of gets rid of some of that thyroid stimulating energy. That stimulating energy of the thyroid. So here's my basic nutritional protocol for Graves' disease. And you're welcome to take this protocol, use it, try it out, and I promise you will have a really good time using it because your patients will get better. It works. Extra water. Any thyroid problem, just a little bit extra water. It's not a ton. It's just more than they normally drink in general. But remember, guys, water is a solvent. Water is not moistening, nourishing, soothing, cooling. Water is not the best coolant. Water is an excellent conductor. It's the music, it's the life, it's the source, but it's the middle between sort of everything. It dissolves stone. It dissolves everything. So just drinking a punch of water does not solve your problem of being dry. Okay, I'm going to talk about salt at length and about plants that really nourish your skin, your tissues, and your body by making them moist. That's not what water does. We need water for conductance, for making everything work, but don't get confused thinking that water is going to make you feel more moist. We got to be hydrated. But if you want to moisten dry tissues and dry skin, we use things like the wild asparagus tuber, the shatavari, that's also called 100 husbands, because it makes you very moist. That's there's herbs that are Rhamania, the Rhamania glutinosa, very moistening, but that holds moisture in your body. And then salt. Water follows salt. If you don't have salt and you drink a lot of water, you're going to strip away your minerals, not give yourself minerals that will hold more water in your system. Cabbage juice, 12 to 16 ounces a day. And the triturating juicers work really well. It's a newer kind of a way of juicing. They're called triturating, and they just take the same amount of cabbage will give you about 3 times the juice from your normal juicer. I learned that from a Graves patient. It was just like getting into his cabbage juice, and he bought this new juicer, and he's like, "You can't believe it! Look at this and look at this!" And I was like, "Wow, that's really cool." Probably pretty expensive, $300 or $400, I'm sure. But they've got to have a juicer. They've got to juice their cabbage every day. You could juice it all in the morning, put it in the fridge, and then drink it throughout the day. You drink your tincture with your cabbage juice. Now, sea salt I put in there as well. 1/4 teaspoon twice a day I like to do. And I like to have them take it with their traditional formula, whatever their constitutional formula is, especially because I'm directing it at their kidneys, right? I'm treating the barometer. I'm not treating the barometer, I'm treating the kidneys. So I'm giving them some sea salt, which guides to the kidneys, anchors fluids into the system, and moistens it, and will also calm down the thyroid too. Salts are very important for thyroid function. Magnesium, always in thyroid. Magnesium is our natural calcium channel inhibitor. It stops tremors. It calms tachycardia. For people that have slow bowels, it helps to move their bowels. It's great for muscle twitches and spasms. So in the thyroid, the sodium iodide symporter, this mechanism that the thyroid uses to bring in iodide and iodine into the thyroid, it's calcium dependent. So once that thing gets kind of going fast, magnesium also inhibits some of those calcium channels and calms the system down. So when we get into our talk about iodine, remember, I need you to have sea salt, water, and magnesium, and then selenium, all in place before you touch iodine. That's what I do. I talked about yesterday and the other day about for this one, if they're Graves and they have that lots of bowel movements, glycinate, because glycinate's the least stimulating form, and I forgot to mention that yesterday. I mentioned all the other forms. And then if it's muscle spasmy stuff, it's malate, and if for the tachycardia, it's taurate. Vitamin D, you got to find their level and get their levels normalized. Okay? We talked a lot about this yesterday, about the right level of D. I want probably 50 to 70. This is what we're going to be. And then iodine. Even in a Graves patient, I have found that my Graves patients often don't quite get well all the way until I add in the iodine, and I don't start with it. I get their selenium levels built up. So I'm going to go into selenium really quick, because what it does is selenium recycles glutathione. Selenium is the limiting cofactor to rebuild your glutathione in this thyroid. So in the thyroid, the little fires are happening, that the peroxidase is happening, right? The iodine's being grabbed into the system, it's being put onto the thyroglobulin molecule, which is like a big couch. Iodine is stuck on the molecule, tyrosine, the amino acid, stuck on the molecule, and then they're bound together. Every time that happens, this iodine in, connecting, hydrogen peroxide radicals are flying off. As that's happening, you're quenching them. Now, if you're deficient in selenium, this has been proven over and over again, in selenium-deficient cultures, their thyroid problems, the rates go up. Because they're not rebuilding the glutathione to quench the free radicals. The free radicals are damaging the tissue, and you have heat, and you have fire, you have this confusing, smoky situation, the immune system gets confused, and you end up tagging yourself as part of the problem. And now you have autoimmune thyroid disease. Okay? It is reversible. But it takes time and energy and looking at the whole system. So selenium is essential, and these are just some studies. One thing I want to say is that with selenium, make sure that if you're giving selenium over a long period of time in a good dose, because you want to help balance out the thyroid by quenching off those free radicals, you make sure that you bring a little iodine in at some point, because otherwise high selenium will start to make things go screwy because there's not enough iodine, just like high iodine without selenium will make things screwy. So they're like on a teeter-totter. And I've just been learning more about this in the last couple of years. Yeah. Yep, Brazil nuts are the highest natural source of selenium. I know they lose a lot of it when they're out of their shell and they're in the thing and they travel around. It's supposed to be a pretty good amount in a handful of Brazil nuts, like 700 micrograms, which is a big dose. I'm not sure how much it is. I definitely like to control the dose a little more specifically for people with these type of disorders. I want to use selenium. I use a couple different forms, but I use a selenium from Scientific Botanicals. A lot of people like to use selenomethionine. There's specific selenoproteins that people like. I find that the selenium I works great. And there's also some natural food sources as well. The dosing for selenium, I've got it here on this protocol. This is a sample protocol for me, how I've built the basics for Graves' disease. A little bit of coconut juice in there too. Very moistening, isotonic beverage, magnesium, potassium, salts, really good for people. I love coconut juice. A lot of folks, when they're on the really, really intensive rescue program, adrenal rescue, I don't have them do it because there's a little bit of sugar. But for people like this, I do, because it's so hydrating. Selenium there, 8 drops, and for me, what that is 200 to 400 micrograms a day. And you can go higher than that. It's not going to be toxic. You can go into small milligram doses, but it's a trace mineral. So we're in microgram doses. Okay? 200 to 400 micrograms of selenium. Very important. Magnesium taurate, 500 milligrams per day. And then iosol iodine, that's one of the sources I use. That dose right there would be 3.6 milligrams of iodine. And that's one where I'll bring the iodine in at a very low amount to start with. Once everything's pretty stable and the person feels good, then we start to get a better result. One of the patients I had, she was a woman doing Watsu with women, in birth tubs, and she started, after actually I'd been treating her for a while, she was doing really well, but then and her original symptom was itching, really severe itching, especially when anything touched her clothing. She was just like, oh my God, I'm just itching everywhere. So in order to get her itching to calm down, we got her on this protocol, and slowly over 2 months her itching went away completely, and she's felt so good. But she went back to the tub and started working with women in the tub, and she immediately got itching back again. And I realized that she had either bromine or chlorine in her tub, and I gave her iodine, and now she's in the tub every day, no problem. So the iodine is retaking its place in the thyroid gland because it was getting disrupted by chlorine and fluorine, or chlorine and bromine, which are so similar to iodine that they will take the same pathway and it mess up the system. They're not the same, but they're close enough that they will actually influence the iodine uptake in the body, in the thyroid. So you have that protocol. So use it, okay? Natural goitrogens, fresh cabbage juice, you're going to do that every day until things normalize. As that TSH comes up, as their T3 and T4 comes down, things get normalized, people start feeling good, you can back those dosages down. Slowly, it's a slow process of watching things happen, taking your dose down. I often combine it with some kind of tea, peppermint, spearmint. People can do it with chai, spices, turmeric, ginger, whatever it is, to help them digest it. Sometimes it can be a little tummy irritating. Depends on their digestion. I've got your list of foods here for Graves' disease. And then I've got a granule formula here. Very moistening, lots of heat clearing, lots of yin nourishing. Okay? Rhamania, wild asparagus, some spleen support here, that Euryales and Aucklandia, some chai hu, that's for the liver stagnation, moving the liver energy. The scrofula, it's very good for the throat, very cooling to the blood and nourishing to the yin. The Difutsa and the Baishampi, that's the dictaminus and kochi, those are specific damp heat clearing herbs that are very good for itching. So this was that itching patient, getting the itching out. Mudan P, the mutan is very blood moving and cooling. A gardenia flower I love for the anxiety, the palpitations. Gardenia flower I add to a lot of formulas just to calm the heat-induced feeling of impending doom. It's good for that. Little Scutellaria bicalensis, that's a damp heat clearing herb, very cold, bitter. And the prunella. Prunella is classic for thyroiditis. It's classic for thyroid, hyperthyroid type of conditions. It clears heat from the liver. I love prunella. Self-heal. It's a good one. Yuanjur, that polygala, that's actually a really good herb for the Shen, calms the spirit. And then anamarana is for yin deficiency with deficiency heat. I use that a lot in women with menopause as well. Anamarana. And you'll see that licorice is in there, and I always put licorice in these formulas when I can because it harmonizes the formula. It makes it better to take and makes the other ingredients work better together. Is that clear on Graves? You feel good about that? Good. Let's go to Hashimoto's. So this is the first autoimmune disease ever identified, and another name for it was chronic lymphocytic thyroiditis because the lymphocytes are infiltrating the thyroid and they're doing their immunological thing inside the thyroid. They're taking care of business. Unfortunately, the business they're doing isn't exactly beneficial for you at this point because that problem, that switch was made, right? Where part of you was tagged. So again, hypothyroid with bouts of hyperthyroid. The thyroid can get enlarged when the lymph infiltration gets to be really big. You get swelling, you get cytokines, you get inflammation, things start to swell, and you can see that actually as a goiter in the throat. It starts to swell. People are like, yeah, I've got this swelling over here. That's a good indication that this process is underway, something's happening. And then fibrosis can occur over time, and it takes longer to get rid of fibrosis. It's basically scarring happening around where the damage is occurring. Where all that free radical damage is occurring, there's repair happening, and the repair is a scarring. So fibrosis starts to occur in these areas, and that takes a long time to undo. You put some vitamin D with your poke oil and your boswellia, your hyalocresum oil and things, you put it on topical every day, that'll help to reduce the fibrosis. Chronic stress is the underlying cause of Hashimoto, absolutely. Combine it with sugar, some goitrogens, a bunch of gliadin and gluten protein, and you've got a recipe for Hashimoto's. So in diagnosis, this is the opposite of Graves. So the TSH, your thyroid stimulating hormone, is elevated. because your pituitary is saying, hey, thyroid, make me some hormone. And the thyroid's going, I'm giving you everything I got. That's everything. I can't do it. This is it. I got what I got. And the hypothalamus says, well, there's not enough. So keep telling the thyroid to make more. And that process keeps going. TSH is going up. The highest TSH I saw was 120. And I'm sure it can go higher, but that's pretty high. T3 and T4 are low in this case. Normally they're not really low, but they're just kind of just low normal or just below the low normal range. The TPO and thyroid antibodies, that's an antibody to the thyroglobulin molecule. Like I said, that's the big couch where the iodine and the tyrosine come together. That thing gets attacked, parts of it. And then also the thyroid peroxidase, that molecule gets attacked as well. And so because those molecules are involved in every single manufacturer of every single thyroid hormone, it's constantly being attacked. It's like every time you want to make a hormone, there you're initiating your immune response. Every time. So we got to calm it down. Okay? Needle biopsy shows lymphocytes and macrophages in higher amounts than normal in that area. You don't need to do a biopsy. You can diagnose this with blood work and symptoms. So this is a little bit different. So the other side of it with the Graves, we had the yin deficiency, right? We had the heat factors. You had liver Qi stagnation. We talked about the different factors, the blood stagnation and the phlegm masses and things that showed up in the Graves' disease. Some of it's different here with the Hashimoto's, more like Qi and blood and yang deficiency. That person that's cold, with the slow bowels, that wakes up in the night, feels unrested, is kind of always a little sad and depressed and can't remember what they were supposed to do. That person is yang deficient. They need this energy to get out there and grab a hold of the world. Basic herbal treatment, administer Qi and Yang tonics. That's classic treatment. Thousands of years of treating this condition before it was ever identified as this condition. Because this condition is really a condition of what's happening again at the organ networks. The spleen Qi is not working right. What is that all about? Digestion, the biome, what's happening with the person's emotional state. And then the barometer starts to show problems. Why are we treating the barometer? Okay, spleen Qi deficiency, liver Qi stagnation is a big one here too. That's that frustration again. Life events that you can't process. Mom dies under the chronic stress of your life, breaks the straw that breaks the camel's back, and suddenly the autoimmune part of it comes out. So the main criteria, if you have those TPO antibodies towards the thyroid peroxidase, you'll see that if that's elevated, they most likely have an autoimmune component. So if you're the kind of person who likes to give people iodine, don't give it to them in that case. Start with selenium, magnesium, sea salt, and water. Okay? We'll talk more about the iodine along the way. And then liver blood deficiency is a big one in the Hashimoto's person that I described. Liver blood deficiency, liver nourishes the tendons, the ligaments. Things start to get stiff. People start to have muscle pains, shoulder pains, aches, things. My hip hurts. All these kind of things start to show up. The blood of the liver is not nourishing the sinews of the body, and it starts to break down, it becomes friable. Another one for a big indicator for liver blood deficiency: floaters. Seeing floaters, not in the toilet bowl. No, floaters when you see. But floaters, liver, can go. If it's in the toilet bowl, it can be like fat metabolism for sure. If your bowels float, that's an indication that you're not metabolizing fast. They're coming through your digestive tract. They're being eliminated, not absorbed. But liver blood deficiency here. Floaters, I'm saying, because the eyes are nourished by the liver. The liver opens into the eyes. So the liver is the source of so much of that quenching, and the liver is where the blood gets its nourishment, gets cleared and cleaned, and then it's used to nourish all the tissues. And the eyes have the finest little bits of machinery in the body. They're just tiny little bits of machinery, tiny little capillaries, and it's really fine instruments. And so they're very dependent on that quenching of the blood and the glutathione, which is in the blood, to cool things down. And when you don't cool things down, then things start to get damaged. And that's why people at 58 to 70 years old start to see cataracts. It's just oxidative damage. And the buildup of that damage is the little bit of scarring and fibrosis that occurs on the eye, which is that buildup of cataract scarring. Okay? The next thing is macular degeneration, where the macula starts to get coating of this oxidative scarring on it. And then the retinal detachment occurs, where the retina detaches from the vitreous humor and starts to extend. Those are all the same processes, but it comes back to the liver and the blood not nourishing the cells to be able to do their job of quenching the free radicals that occur as we age. Okay? Just a little side note. Pregnancy, important in pregnancy. And you won't get pregnant if you don't get your thyroid right. If your thyroid's screwy, you won't get pregnant. So if people come to you for fertility issues and you don't straighten out their thyroid, it's not going to be a fun experience for both of you. You're going to be frustrated. So you've got to get the thyroid right first. And if you can't tell it's a thyroid problem by the symptoms and you can't get it normalized, have somebody do the blood work and see what's going on in there. But people who postpartum rates of Hashimoto's are much higher in pregnant women who are positive for TPO antibodies. That just makes sense to me. But it's interesting that it doesn't, sometimes hormone problems go away when you're pregnant. You might feel better during pregnancy, but then as soon as you come out of it, it's going to manifest. So make sure you treat the people through their pregnancy as well. And like I said before, vitamin D is so essential. I find Hashimoto's to be not as dire as Graves. Graves, people look at their endocrinologist and they're like, we're going to basically have to radiate you or take your thyroid out, you're going to die. And it's really heavy. And they're like, oh my God, I have a serious disease. Hashimoto's, people are like, you have an autoimmune disease. They're like, oh my God. But at the same time, you're doing your life, you're functioning, you're kind of not feeling that good, but you're not at risk of some really dire consequence. So it's got a little different level of intensity as far as the treatment goes, but when I treat people with Hashimoto's, it's a long course. And I've gotten a lot of people who were Hashimoto's out of Hashimoto's. It's not that hard, actually. And I used to, before TPO antibodies were really present, I used to just look at TPO. And I'd see TPO go into the thousands, and then it would come down into the hundreds. And on one patient, it would vary over months. It would just go everywhere. And eventually, you just kind of see it go down, 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 and the TPO will go away. If you just do the basic protocol that I gave you, which is that, magnesium, sea salt, water, a little bit of iodine, and the selenium, you'll help a lot of these people. Now, this protocol adds a few things. Fatty acids, really important. Fish oils, krill oil, or your borage oils, whatever your oils are that you like to do, get those in place so they've got good fatty acids. The vitamin D, I can't say enough about how important that is. It gets the immune system to be clear. Got to have it right. It's also like the sun energy. So with the fire of the thyroid, it's a big connection there. Got to be right. Melatonin, sometimes for people, get their circadian rhythm right. We talked about using adrenal in the morning. I often will use whole adrenal in a patient like this too. The glandulars, I talked about it in the adrenal fatigue. It works really well in this case too. Get that person's energy up for a few weeks on the whole adrenal, and then drop that off and hold them together with herbs and diet and lifestyle. A little bit of energizing iron for someone. I like that one because it's iron that's extracted from liver. It's liver iron. It's liver tissue. It's a fatty material. And so it's like 1.1 grams of liver rather than, isolated iron. Much more absorbable. These are some formulas that I added. A spleen tonic, and that was a formula I talked about yesterday, the astragalus and angelica decoction to build the blood. Really nice to nourish the blood. It's basically that 5-to-1 ratio of astragalus to angelica. That's a great way to build people's blood. And so, take a look at this. Hey, Mark, thanks for coming. Great to see you, man. Great hat. Take a look at this. If you have questions, you can always email me, check in with me about these things, and I'm more than happy to answer questions. This is a formula that I made for this person, a tincture. And so she needed that adrenal adaptogen support. Eleuthero, white panax, rhodiola, some American ginseng, ashwagandha, coleus, a really great herb, very thyroid specific. Although as a standalone herb, I haven't seen it do anything amazing. I've heard a lot from my teachers that it's this great thyroid herb, and I think it is, but I think people need more. They need the nutrition, they need the lifestyle part, the diet, and they need a few other herbs and things to work together, because it's not just the thyroid. Like I said, the liver is going to regulate thyroid metabolism, the kidneys are going to regulate thyroid excretion, so if either one of those places are screwed up, and you're treating something else, you're missing that part. You've got to get those systems working well. And then you've got the thyroid being produced in the thyroid, and you've got the cellular conversions. And so selenium, I didn't mention that the thing that's so important about selenium, here's the kidney liver thing here, right? When the reverse T3 issue, right? So as that iodine is being stripped away from T4 to make it T3 to make it bioavailable, if you don't have selenium present, what you'll do is you'll strip it off of the 5 position, the 5th carbon, not the 5' carbon. Now, this is kind of chemistry stuff, but there's 2 big rings on the thyroid hormones, one here and then one here. They go like this. They're both like cycles of 6 carbons. And the 5th position on each one of those is where the 1 iodine gets stripped off. There's iodine at the 3rd position and the 5th position, and then there's 2 and 4. There's iodines at all those positions. And if you go through and strip one off of the outer ring, that's your 5'. That's your main, that's T3. If you strip one off the inner ring, that's T4. I'm sorry, reverse T3. So the idea being, if you don't have selenium and you can't make T3, you make reverse T3. And the reverse T3 is unusable. It doesn't trigger your body to make energy. It doesn't induce cellular metabolism. It gets stored, okay, or excreted. The liver and kidneys get rid of reverse T3, and we want to get rid of it because it actually has a disruptive role at the cell. Reverse T3 actually interferes with the function of T3. So another reason why selenium is so important. Now, you measure reverse T3, and remember, you're not looking for some gross, like reverse T3 is off the roof, but if you're looking at the person's TSH, their free and total T3 and T4, and you're looking at their reverse T3, everything should look good. The ratio should be right. TSH should be in the middle of the range, T3 and T4 should be in the middle of the range, and then the free fractions should be good, because those are the available parts of T3 and T4. They should be good, in the middle of the range. And now if your reverse T3 is also in the middle of the range, everything looks good. That's great. But if a person has a low T3, okay, and they have a low free T3, but they have a normal T4 and a normal free T4, and you don't look at their reverse T3, you might just give them T3. But what if all that T4 energy that was supposed to be converted to T3 went into T that was reversed? Reverse T3. Now you see that what's happening is it's a conversion error. So the person doesn't feel good because they don't have enough T3 to activate their cellular function, and they have all this reverse T3. Okay, so we got to correct that problem. I want to talk about C materials. Chinese medicine uses lots of C materials, and they started adding iodine to salt basically when people who didn't live by the ocean started having problems. If you live by the ocean, you get lots of salt, you get lots of iodine from oysters and mussels, you get it from kelp. Kelp has a lot of seaweed in it. And then Chinese medicine uses salty materials like this to resolve phlegmy masses, so that goiter type of thing, really great for that. It also has a profound effect on phlegm in the body. Salt is one way we get rid of phlegm. So when you're treating phlegm in Chinese medicine, you often use seaweeds. And they always use seaweeds for thyroid problems, for goiters. And then shells, oyster shells and conch shells, they're like powdered and they're very calcium, they're very like settling, they're very calming to the system. Those things, it's a calcium that's not absorbed, but it just kind of calms everything down, cools the stomach. So for Graves patients, I use muli or a longu or the oyster shell to calm things down in the system. That's what they're used for. They settle out the wind, they sedate the body. Wind is the tremory stuff in Chinese medicine, so you want to calm down the tremors. So C materials have been used for thousands of years for treatment of these disorders before they were called thyroid, disorders. So quick about iodine, largest element that the body uses, that biological organisms use. It's got that's what really makes it better than fluorine and chlorine for us, because those are very reactive compounds. Iodine is in the same column in the periodic table as fluorine and chlorine and bromine. So look right here. Okay? The column identifies how many electrons are in the outer shell of that molecule or this element. Okay? The outer shell determines how it's going to interface with other things. So these guys all have the same outer shell, basically. Once you get to bigger layers, it starts to change how many there are, but it's the same kind of interface. So iodine is what we use in the thyroid, but if you're exposed to a lot of bromine and chlorine or fluorine, and you're not getting enough iodine, your thyroid goes haywire because it's trying to use the chlorine and fluorine and bromine to do what it wants iodine to do. But look, electromagnetic energy, the polarization of this chart starts the lowest here and goes the highest up there. Fluorine is like the bomb. It's just like, boom, it's so electronegative. It just, as soon as it sees something else, it's going to take something from it. Whereas you go down in electromagnetic polarity, down to iodine, it's much more mellow, way more mellow. So that's why we use chlorine in the pool, because it kills things. It's just destroying cell walls of viruses and bacteria and everything else. Bromine does that job as well, destroys things too. Fluorine we can't use in the pool because it's just so reactive. It explodes when it contacts things all the time. So we got to get the fluorine and the chlorine out of our diets, and we got to get out of our environment. And it's all these compounds that are being out there now, that are being put out in the world. The PCBs are big ones, right? The polychlorinated biphenyls, and then the polybrominated diphenyl ethers, like flame retardants and coolants and things like that. But then also chlorine in a lot of things. Bisphenols that are turned into chlorine compounds. chlorine in your water. It also has an estrogenic effect. It interrupts your thyroid. These are endocrine disruptors that we're putting into our water supply. Very interesting choice. So, we might as well just toxify the water and then poop in it. I mean, come on. Let's just finish the job, right? So potassium iodide, that's the main way that we get iodine these days. Although I use this other wellness resources because it's a lower potency. Potassium iodide is normally pretty high dose per drop. You get about, and I have one, Scientific Botanicals makes a tri-quench. That's like 19 milligrams per drop. Now, that's a pretty big dose. Physiological doses for the RDA are about 150 micrograms a day. We're talking about going a lot higher than that. Things that iodine influences, it's necessary to make thyroid hormones. It's part of the thyroid peroxidase enzyme system, and it's part of the syn-porter system that brings the iodide into the thyroid. So the iodide is what the thyroid wants, and then it converts it to iodine. And then it puts the iodine with the tyrosine and makes the hormones. Okay? In that process, though, it's very fiery and reactive. So if a person has an out-of-control system and you just start dumping iodine in there, man, what are you doing? You're creating fire. You're putting fuel in the fire. That's why I mentioned glutamine yesterday. And if you dump glutamine in huge amounts into a system that's driving itself on sugars like that, and glutamine could be like that, you have to just be careful. And it's always context-driven. Context-driven. So Lugol solution I'm not going to talk about. There's some information for you. This is how iodine was determined, and they could get higher concentrations of it in water. Chinese were using seaweed at 300 AD. It's been used for hypothyroid since 1820. And then we have preferences. Iodide goes to the thyroid glands, the skin, and the salivary glands. And then iodine, really good for the breasts and ovaries and prostate. Now, prostate cancer, a lot of people like iodine in treating prostate cancer, ovarian cancer, breast cancer. I'll tell you one thing, fibrocystic breasts are often a big part of that hypothyroid picture and iodine deficiency in women. You'll find women have these fibrocysts. You can do iodine internally with the rest of their stuff and start to really have a profound impact on breasts and their fibrocystic nature. And remember, fibrocystic breasts are more likely to move towards a problematic situation down the road. They're not problematic on their own, but they are predisposing. Ovarian cysts as well. Yep. And again, back to that phlegmy nature. Chinese medicine looks at ovarian, PCOS especially, as a phlegm type of condition, which goes back to our pond and our dampness and our sticky, gooey, phlegmy stuff. That's the PCOS. That's the insulin-driven, insulin-like growth factors, the people that are a little more overweight and obese. It also pushes the dihydrotestosterone problem in women, where they get a little hirsutism and a little acne. That's the PCOS thing, and you can treat that no problem. You can really get at that. That's not hard to treat. RDA of iodine, look how low that is. It's tiny. The Japanese eat a lot more. I heard that this number should be changed because some of the research came out and changed it. Thank you. Are you guys okay? It's 10:10. You guys okay for a minute? Yes. Okay, good. Recent research shows strong anti-cancer activity in breast cancer cells at higher doses. Great. You want to give your cancer patients oftentimes high doses of iodine, but just be careful. Do the work first. Get them on the magnesium. Get them on the sea salt. Get them on the extra water, and get them on the selenium. Make sure you got all that stuff in place. Change their lifestyle. Get them on some herbs. Then they can take iodine. Okay? Sodium iodine syn-porter, I kind of mentioned this, the first step in thyroid synthesis, regulated by thyroid stimulating hormone. And remember, thyroid stimulating hormone stimulates activity in the thyroid. So when people have thyroid cancer, TSH becomes a tumor marker. It becomes an indication because the cancer will start to drive on thyroid stimulating hormone because it'll stimulate growth of thyroid tissue. Here's the two iodine schools, and it took me a long time. I've been weeding through this iodine thing for a long time, like 5 years of digging into it, because it's been this thing, like this is how it is, Brownstein and his school of people say 50 milligrams of iodine for everyone, and this Karazian group says nobody should do iodine if they've ever had any antibodies. And I'm like, no. BS, guys. It's like everybody should do vaccines, nobody should do vaccines. It's like, come on, let's just freaking find out the right solution for the person in the moment, and we can do a good job. Okay? I want to get that out there. Don't take iodine to protect yourself from Fukushima. Don't let your patients do it either. Okay? It's only taken at direct exposure to iodine 131 in the immediate time when you're getting a huge influx of iodine, and you have to protect yourself. You flood your tissues with iodine, 130 milligrams a day. potassium iodide, and you take that every day until there's no more exposure. Because the thyroid, that's why the 24-hour urine test works so well. Because if you take iodine, it'll pass out of your body if your stores are full, or it'll be absorbed if your stores are empty. So the idea is fill up all your stores with iodine, then whatever comes, whether it's radioactive or not, it's just going to pass through you. And that worked in Chernobyl. We know it did, because the people who didn't take iodine got thyroid cancer, a big percentage of them, and the ones who did didn't. But don't take it now. People get really confused. People are always trying to take iodine. And it's like, oh man, we're worried about strontium, we're worried about cesium, we're worried about plutonium and uranium. Those are the things that are going to hurt us. And so salt, just to give you guys just the importance of salt. I keep hitting it and mentioning it. It's the anchoring root of the kidney. It guides to the kidney. It holds fluids in our systems. It's what makes life possible for us. We came out of the womb. It was full of salt. Animals go miles and miles to find it. People were paid in salt. It was called, the word salt comes from the word salary, because people were paid their salary in salt. That's how important it is. These monkeys, they climb the walls of these things to find, anyway. And don't get confused into thinking that salt is going to cause your blood pressure patients to have their blood pressure go through the roof. It's not like that. It's just not that simple. People need salt. And by trying to get everybody on a low salt diet, and this whole 1,500 milligrams a day thing is insane. The British eat 9,000 milligrams a day. Most of our research is showing one side of it, 7,000 milligrams is better, 3,000 milligrams and up you need to have, or you're going to have terrible outcomes. And the other side of it says you need 1,500 milligrams or lower, or else you're going to die. And it's the same thing. It's the duke it out until, we just debate the two sides of it until somebody collapses. And let's not do that. Let's just work with each patient. We'll give some people sea salt. We'll watch their blood pressure. If they need help with fluid metabolism, we got lots of plants and nutrients to do that. Lots of foods that we can help them with. And here's some research just to back you up. If anybody says salt causes hypertension, you got papers right here. Okay, look at them all. Bam. This is a little bit of, and Michael Schachter, he's a doctor in New York, great guy. He helped me with a couple of those slides. I took them from his presentation. Thank you so much for the weekend. You've all been wonderful. It's really been a pleasure. Thank you.